Understanding Thyroid Issues in Older Adults. Welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. In this video, I'll explore the unique aspects of thyroid problems in people over 60, including differences in symptoms, diagnosis, and treatment. Thyroid issues, while not exclusive to any age group, become increasingly common as we grow older. Let's delve into why this happens and what it means for your health. Thyroid disorders can affect anyone, children, teens, adults, but their prevalence rises significantly with age. Research shows that by age 70, the likelihood of having thyroid issues increases. These conditions are often chronic and require lifelong management. Yet, many thyroid problems, especially in older adults, remain undiagnosed or misdiagnosed, making the issue more significant than it may appear. Hypothyroidism, the most common thyroid disorder, occurs when the thyroid gland doesn't produce enough hormones. Up to 10% of older adults may experience this condition, though the actual number is likely higher due to underdiagnosis. But first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. Let's begin. In older adults, hypothyroidism symptoms often present subtly or mimic other health issues, making them easy to overlook. Here are the key signs to watch for. 1. Worsening of existing health conditions. For example, someone with well-controlled blood pressure might suddenly experience unexplained increases. Thyroid hormone imbalances, either too high or too low, can directly affect blood pressure. Similarly, cholesterol levels may rise dramatically. A person with consistently normal lipid levels might see a 50–60% increase due to low thyroid hormone production. 2. Memory and cognitive changes. Forgetfulness is a near-universal symptom reported by individuals with hypothyroidism, particularly in older adults. This cognitive decline is often one of the first clues leading to a thyroid evaluation. 3. Mood disturbances. Depression, mood swings, or an unexplained decline in mental well-being may indicate thyroid dysfunction. 4. Metabolic changes. Subtle weight gain, typically around 2–4 kilograms, may occur due to swelling, non-pitting edema, rather than fat accumulation. Constipation and cold intolerance are also common complaints in hypothyroidism. 5. Physical signs. Hair thinning or loss, brittle nails, and dry skin are telltale signs of low thyroid function. On the other end of the spectrum is hyperthyroidism, where the thyroid produces excessive hormones. This condition often manifests differently in older adults compared to younger individuals. 1. Apathetic hyperthyroidism. While younger patients typically experience agitation and restlessness, older adults often show opposite symptoms, such as lethargy and fatigue. This presentation, known as apathetic hyperthyroidism, is frequently overlooked or misinterpreted. If you notice a sudden or unexplained worsening of health conditions, such as spikes in blood pressure, cholesterol, or blood sugar, these could be signs of thyroid issues. Forgetfulness, mood changes, and unexplained physical symptoms should also prompt a thyroid evaluation. It's important to remember that while thyroid issues are common in older adults, they are not a normal part of aging. Proper thyroid hormone levels are vital for the body's functioning at every stage of life. If you experience any of the symptoms described, seek medical advice and testing to address potential thyroid dysfunction early. Have you or someone you know experienced thyroid issues? When were they diagnosed, and how have they impacted your health? Let me know in the comments. I read and respond to every message. Your experiences help us learn together. By better understanding the nuances of thyroid issues in older adults, we can promote earlier detection and improved management for a healthier, more vibrant life. Among the many symptoms of thyroid dysfunction, weight loss stands out as a significant indicator, particularly in cases of hyperthyroidism. For elderly individuals, weight loss isn't just about shedding pounds, it often signals an underlying health issue. Unlike intentional weight loss through diet or exercise, this is unplanned and is frequently accompanied by a sense of unwellness or fatigue, which can make daily life more challenging. Hyperthyroidism in older adults can manifest in ways that may differ from younger populations, including 1. Digestive changes. Diarrhea or frequent bowel movements may develop, often overlooked as a thyroid-related symptom. 2. Heat intolerance and increased body temperature. Elderly individuals might experience unusual sensitivity to heat, causing discomfort in environments that previously felt normal. 3. Skin alterations. Skin may become dry and flaky, a symptom that overlaps with aging but can be exacerbated by thyroid dysfunction. 4. Heart function changes. Thyroid hormones have a direct impact on cardiovascular health. In older adults, this often presents as arrhythmias, including atrial fibrillation, which can lead to complications like blood clots or stroke. Given that cardiovascular disease is the leading cause of death among older adults, closely monitoring thyroid function is critical. Excess thyroid hormones increase the risk of heart complications, making early detection and management essential. 2 primary causes are prevalent among those over 60. 1. Toxic nodular goiter. This condition involves the development of multiple nodules on the thyroid gland that produce hormones uncontrollably. It becomes more common with age and can lead to excessive hormone levels. 2. Graves' disease. An autoimmune condition in which the body attacks the thyroid gland, causing overproduction of hormones. This involves the creation of thyroid-stimulating antibodies, TSH receptor antibodies or TRAB, leading to hyperthyroidism. In contrast, hypothyroidism, where the thyroid fails to produce enough hormones, is often caused by Hashimoto's thyroiditis, another autoimmune condition. In this case, the body produces antibodies like antithyroid peroxidase, anti-TPO, and antithyroglobulin, which inflame and impair the thyroid. Treating thyroid disorders in older adults requires a cautious and personalized approach. 1. Starting dosage. Unlike younger patients who tolerate higher doses of thyroid hormone replacement, levothyroxine, older individuals require a slower introduction of treatment. A sudden high dose can cause adverse effects, particularly on the heart, leading to symptoms of hyperthyroidism like palpitations, anxiety, or even arrhythmias. 2. Gradual adjustments. Medication doses are carefully increased to ensure the patient adjusts without triggering excess hormone levels. This gradual process is essential for avoiding side effects and maintaining overall health. 3. Targeted hyperthyroidism treatment. For conditions like toxic nodular goiter or Graves' disease, the approach often involves medications that reduce hormone production. Identifying the specific cause determines the best treatment plan, which might also include radioiodine therapy or, in some cases, surgery. Managing thyroid issues is a partnership between patients and healthcare providers. If you've noticed symptoms such as unexplained weight loss, changes in skin texture, heart irregularities, or heat intolerance, it's crucial to seek medical advice and undergo thyroid function tests. For those already diagnosed, share your experiences. When did you discover your thyroid condition? Have you noticed changes in cholesterol, mood, or cognitive function? How has treatment impacted your quality of life? Thyroid health is vital at every stage of life, and symptoms in older adults often require a more nuanced approach to diagnosis and treatment. While aging and thyroid dysfunction may share some overlapping signs, Thyroid issues are not an inevitable part of getting older. They are treatable medical conditions that should never be ignored. By recognizing the symptoms early and addressing them effectively, we can ensure a better quality of life for older adults facing thyroid-related challenges. Don't forget to like this video and subscribe to this channel if you have not already, and enable notifications for our latest updates. See you in the next health journey.